Hi, my name is Shoshana Wilkinson, and today I'm going to perform a physical assessment of the lungs and thorax. How I typically begin any assessment is I walk into the patient's room, I introduce myself. Hi, my name is Shoshana, and I'm going to be your nurse today. And then from there, I would go ahead and wash my hands, perform hand hygiene in front of the patient. Then I would go ahead over to the patient and ask him for his name and date of birth.
John Curtis, March 1st, 1985.
Okay. And you're here for a physical assessment of your chest and your lungs, correct?
Yes.
Do you have any concerns today with them? Are you having any pain or any difficulty breathing?
No.
Anything I should know about? Okay. So no concerns today and just here for a physical assessment.
Yes.
Okay. From there, I would go ahead and put his paw socks on. Go ahead and take a set of vitals is what I would do. Heart rate, blood pressure. I would go ahead and count his respiratory rate. I would watch the chest rise and fall, count each one of those for a minute. For the sake of time, we're going to say that his respirations were 18 and they were good because he's not having any issues. His oxygen saturation is 99%, which is perfect. And then I would also look at the quality of breathing at this point, like make sure that that's symmetrical as I'm counting the respirations. Make sure everything's even. And so from there, I would go ahead and take a pain scale if there would be any pain upon breathing or just a general pain scale. And so after that, I would go back to asking some questions and let the patient know. During this assessment, I'm going to ask several questions. I will go ahead and listen to your lungs, listen to your chest cavity, and go ahead and feel around your chest cavity and make sure that there's no tenderness, no nodules, no areas of concern that I see or that you tell me that you feel. And let you know that that's the plan for this short video. And so then I would ask the patient, again, there are no concerns today with your chest or your lungs.
No.
Do you have a history with lung issues or have you ever had any surgeries on your chest, anything like that of that nature?
No.
You don't have asthma, you don't have any other lung diseases, emphysema, COPD, or anything of that nature that I need to know about?
No, not me personally.
Do you have a family history of asthma or COPD or emphysema or any of those?
No, my grandfather passed away from lung cancer in 95.
Okay.
No.
All right. And do you smoke?
No, used to. On and on for about 20 years.
But you don't smoke anymore, even occasionally? No. You don't smoke at all? Okay, no. That's good. And then I would go ahead at this point and be observing my patient for his posture, for basic things like his general appearance, to see his mood, and he seems to be relaxed and calm. It looks like he does have good posture. His skin color is good. I'm not noticing with his breathing effort anything that I should be concerned with as a nurse. Everything checks out for his general appearance. I would then go ahead and move on and look at his chest and make sure that everything is symmetrical. I'm going to have you go ahead and take off your shirt for this next part because I have to be able to see different things. So then I would go ahead and look at his muscles, and his muscle tone looks good. There's not a difference. Both sides look pretty even. As far as that goes, I then would look at his costal space, or his costal angle, not a space, I'm sorry. And I would do that by putting my hand right here, making sure that that feels like a 90-degree angle. It looks like a 90-degree angle, which it does, which is normal for your costal angle right there. I then would look at his anterior, posterior, diameter versus his transverse diameter, and it should be 1. I look at the side, and then over here it should be about 1 to 2, which is normal. I would also go on to assess his fingernails, make sure they blanch and go back to their pink color within 2 seconds, which they do. Again, I would look at his fingers, his lips, the end of his nose. There's no blueness. Everything looks pink, and that's what you want during the appearance part of the physical assessment for your lungs and breathing and respirations and all that good stuff. I would then look at his breathing pattern. Is it normal? Is he skipping a breath? Is it is there anything out of the ordinary that I see? Make sure that his chest is rising and falling symmetrically, which it is. So that's good. That's what you want. I then would go on to explain that everything so far is checking out. His posture is good. All that stuff is checking out. And then I would go on to explain that over these next few steps, I'm going to do things like percussion to make sure that there's no areas of dullness. I'm going to listen to your lungs to make sure that I can hear everything and there's no adventitious sounds. And then I'm going to palpate areas and make sure that nothing's tender, there's no nodules, nothing that we are to be concerned with. So I would go on and I would start percussing the different areas. I would also go ahead before I percuss and make sure that where his trachea placement is good. And it is. So, your lungs start actually like right up here. So this is where I would start the percussion. And with percussion, you just take, can you lift your head for me for just a second? Thank you. I take 2 fingers because my fingers are small, and I just hit a couple times, and you want to hear that sound because that means there's no dullness and it's resonating good. So everything resonated good in the anterior position. I'm going to have him turn around, and I'm going to go ahead and percuss the back. And again, I didn't hear any areas of concern during that part of my physical assessment. Since he's already turned with his posterior side towards me, I'm going to go ahead and start just palpating different areas. And let me know if you have any pain or tenderness. Any tenderness? Okay, and then I'm going to have you turn back around and palpate. Just let me know if you feel any pain throughout any part that I am touching. There's no tenderness. Okay. And then I'm going to go ahead and move on, since this is a pretty easy assessment, nothing's wrong with this patient, to auscultating. So I'm going to go ahead and do that. I'm going to have you do a couple different things to make sure that different things check out. Okay? So, another thing that I would have looked for throughout this physical assessment is I'd want to make sure that his chest expansion was good, and throughout this physical assessment it has been symmetrical and good. And so Then I'm going to start my listening. I'm going to have you take a deep breath in. Again. Go ahead. And this is what we would call the bronchial vesicular space where I'm listening. Up here is the bronchial space right around that trachea and over the trachea that I listen to. I then would go down here. Go ahead and take a deep breath in. Thank you. And this is the vesicular part of the lungs. They're right at the peripheral lobes or peripheral part of the lungs. Okay. And there's no ambitious sounds, which is what we expected because he just is getting a routine checkup. Go ahead and take a deep breath. Come to the back. Deep breath. Okay. Another deep breath. And you can do this, like, you don't have to do it whenever I'm saying it because we don't want the patient to just be taking deep breath after deep breath and getting lightheaded. But just whenever I move, go ahead and take a deep breath. Okay. Again. Okay, and that checks out. For this next test, I'm gonna have you go ahead and say 99 every time I move the stethoscope, okay?
No.
Go ahead.
Okay.
Go ahead and say it.
99.
Again.
99. 99. 99. 99. 99.
Okay. And then I'm going to go ahead and do the same thing with the front.
99. 99. 99. 99. 99. 99.
So, and then I believe that completes our physical assessment of the lungs and thorax. This was a simpler assessment because you do have a healthy patient, and there was no issues. So, that's it.